If you have large breasts that give you symptoms such as neck pain, shoulder pain, back pain, you may be a perfect candidate for breast reduction surgery. I get over 90% of breast reductions that come into my practice for consultation. 90% of them I get approved through their insurance company. It's very nice to get them covered by insurance because otherwise it would be a completely out-of-pocket expense where you'd have to pay the surgeon's fee, the anesthesia fee, and the operating room fee. So I give everybody an instruction sheet on how we can get them covered by insurance. And insurances are getting tougher and tougher with this, but we're still fairly successful in getting them covered. So what the insurance companies are looking for is that you have had these symptoms for a while, that they're chronic, and that they affect your life. So what we do is have you try to get a letter from either your OBGYN, your primary medical doctor, your breast surgeon, your dermatologist, or even your pediatrician if you're under the age of 18 years old, documenting your symptoms. So in terms of documenting your symptoms, if you have shoulder pain, neck pain, back pain, they're going to want to state that and state that you're an appropriate candidate for breast reduction. If you have deep shoulder grooves from your bra straps, they also want to document that. If you have rash underneath your breast from it being a moist area, especially during warm months, then they want to document not only that, but what they treated you with, whether it was a antifungal, powder, or cream, and for how long they did that. If you've seen an orthopedic or neurosurgeon for back problems related to your large breasts and poor posture, that would be a great note to have in order to get insurance approval. Another great one is whether you've seen a chiropractor or a physical therapist. If they're looking for those notes, they usually want to see that you've gotten treatment for at least 3 to 6 months. Some insurance companies say you have to have 6 months or you have to have even 12 months in order to get approval for insurance. What we'll also need is either a mammogram or an ultrasound if you're over the age of 30. Insurance companies definitely want it if you're over the age of 40 because those are the national guidelines for imaging of your breasts, and they just want to make sure that you have no precancerous or cancerous lesions in your breast before you undergo a breast reduction surgery. So we have you fax all of these documents to our office, and you can either do it before you come in for a consultation or even after you come in for your consultation. Our fax number is 203-374-0314.